Good morning, Aaron Murphy. This is Dr. S.L.A.P. Today is September 25th, 2008. This is arthroscopy of your right shoulder. We're looking from the back to the front. With you asleep, your shoulder felt fairly stable, just some slight laxity with drawer testing. You're lying on your left side, and we're looking from the back to the front. So your head's off to the left of our screen, your feet are off to the right of our screen. This here is the ball. This circular thing here is the top of the humerus, or the head of the humerus. This is the glenoid, or the socket. And here is this rope-like structure, is a biceps tendon that comes in and attaches to the top of the labrum. This is the area we were worried about, and sure enough, this is pulled off or torn off the top part of the bone here. This is unstable right here. When I pull on the biceps, you can see how that kind of pulls away, and it even has some fraying and a little bit of shredding of the labrum surrounding the socket right beneath this glenoid right here. As we come around the front, if we lift the arm away from your glenoid, we can peek down the front at these ligaments up front, and if we twist your arm, I can see how the ligaments tighten up right here, and I think that's okay. The labrum has not torn off the lower part of and the capsule has not torn off the lower part of your joint, but right up top as we're coming up into here, in the front here and right behind that, this is abnormal superior labrum, and that's what we're going to work on. And I have a shaver. Everything's quite magnified. Actually, let me show you. If I look up above, this is your rotator cuff tissue coming in, and the tendons coming in and attaching, hang on, to the humeral head in here. And that part looks good as well. I just want to make sure that you can relax. Come out. And as that comes in, you see a nice attaching into the footprint of the ACL. And then your biceps tendon, as it leaves, I don't see any tearing or fraying of that. So at this point, everything's quite magnified. The little faint black etchings on this probe, you can barely see, are 5 millimeters increments. The end of this probe is about 3 millimeters. This cannula is what I put in there so I can put instruments in and out without having to poke through your muscle multiple times. And as this shaver comes in here, it has this blade, and then when I step on a pedal, it'll spin back and forth like that. And when we turn on the suction, it'll suction in these torn portions of this labrum. So right now I'm going to take out some of the torn portions of the labrum, especially towards the back here, and then clean off the bony area where we want to reattach this detached labrum to. And once that's prepared, we put some stitches in that, and I'm going to show you most of that, but I turn this off and on while I'm working so it doesn't slow down your surgery as we go along here. So I'm going to turn this back on to show you once we're prepared and putting some stitches in there.